The backlash to President Trump linking Tylenol use during pregnancy with autism without clear evidence is going global. Several international health agencies are now criticizing him. The United Kingdom's health secretary has told people there, quote, don't pay attention whatsoever to what Donald Trump says about medicine. Joining us now is Kossow. She has 2 kids with autism and is an advocate for parents of neurodivergent children. Karen, I'm going to talk to you and then I'm going to talk to a couple experts after. But when this announcement came, I just thought about parents like yourself who have children with autism, who might be feeling all kinds of things, perhaps shame, perhaps guilt if they took Tylenol in pregnancy. How are you? How is your family feeling after this announcement?
We're following the news. It's just incredibly disheartening. There's many reasons that ultimately lead to an autism diagnosis: genetic factors, environmental factors. I think this bears more research, but to just come out and tell pregnant women to stop taking Tylenol, I think is dangerous. And I think that for those of us like myself who did take it during pregnancy, it just kind of comes back to that idea that when it comes to autism, that a lot of the times it's the mother's fault. The mother did something different or did something wrong, and we're the ones bearing most of the caregiving burden and the struggles of supporting our children. And it just feels like another burden that we have to bear.
Oh, I'm really sorry to hear that. I'm really sorry. That makes me very sad. And I also think it's important to talk about kids with autism and how it's not defining, and also autism can give them a superpower. And I feel like sometimes this is also giving a stigma to autism, right? That must be hard for parents like yourself and others in your community experiencing this.
100%. And one of the problems that you see even within the autism community itself is that the spectrum is now very, very wide. And it goes everywhere from a person like Elon Musk, who has self-identified as being diagnosed autistic, to a child who is non-speaking and needs total support for all activities of daily living. So it's a very, very wide spectrum. And I think at both ends of the spectrum, people feel like their needs are being ignored. And when a blanket statement like this comes out saying Tylenol is the cause of autism, when there's genetic factors, there's certainly environmental factors to be concerned. But at the same time, we're cutting supports for families like mine. It really leaves me wondering what the goal of that whole press conference was.
When you say cutting support, how so?
Well, I can only speak for my state. I'm in Idaho right now, and we have a 4% Medicaid clawback on the reimbursement rates for providers. We are already lagging behind our neighboring state of Montana in the reimbursement rates for caregivers. We are in the middle of a huge caregiving crisis. Idaho recently terminated the Family Personal Care Service Program, which enabled parents like me to be paid for the caregiving services we were performing for our children. It was the state guidelines. Our children qualified for these services. There are no available outside caregivers. And, Idaho got federal approval from CMS to terminate that program this past July. So when we're seeing cuts and we're not getting the support that we need for the autistic families and children that are already here, and we're blaming mothers for taking Tylenol without further research on the effects when it's the only available pain reliever women can take when they're pregnant, it just seems irresponsible.
All right, Karen, stand by. I want to bring in 2 medical experts. We have Dr. Natalie Crawford, a fertility physician, and Professor Renee Gardner, a principal researcher at the Karolinska Institute's Global Health Department in Sweden. Professor Gardner, I want to go to you first because you did this huge study that actually I looked at when I was pregnant last year. It gave me a lot of peace of mind taking Tylenol when I had COVID and the flu. You compared siblings who were born to the same mother when the mom took acetaminophen during one pregnancy but not the other. How did your findings square with what the Trump administration says?
I would say they don't square at all. As a matter of fact, we did the study for precisely the reason you said. We wanted to be able to give good answers to expectant parents and to parents of children with autism. And we didn't see any connection between acetaminophen use during pregnancy and children's likelihood of conditions like autism or ADHD when we were able to do that really good comparison where we looked at siblings who were born to the same mom and the same dad.
So, Dr. Crawford, I want to bring you in. I'm sure you've looked at that study and mentioned it to your patients. So, the president repeatedly stated on Monday when he made this announcement there is, quote, no downside for pregnant women to avoid Tylenol, and that pregnant women should just, quote, tough it out. What is your response to that, and how are you advising your patients in light of this new government guidance?
Well, it's actually a false statement because fever itself can be very dangerous in pregnancy. We know that having a fever defined as a temperature over 100.4 degrees Fahrenheit can cause neurodevelopmental delay like autism itself, but also miscarriage, birth defects, preterm birth, stillbirth, growth restriction. Those things are not associations, those are known consequences that can happen from a fever. So we want pregnant women to feel like they have all options available to them. If they do have a fever, they need to be treated. In addition to the fact that pain control is really important for women, for pregnant women, pain can be very stressful. We want pregnant women to know that there is no proven link that Tylenol causes autism. And in fact, the consequence of not treating a fever can be much more devastating even when it comes to the brain's development. So I'm still telling my patients to take Tylenol. I'm still telling them, as we always have for pregnant women, don't take anything more than you need to. But if you're in pain, if you have a fever, you should know that there are medical options that exist. And it's important for the public to know that other pain and fever medications are not recommended in pregnancy. So this is one of the only medical options for women. And taking this away really is doing a disservice to all pregnant patients out there.
And Dr. Crawford, have you been getting a lot more calls from your patients seeking clarity on this? Tell us about that and the confusion this may have caused.
This is causing such confusion because already pregnant women have so much fear about what they can do. They want to do everything right for their baby. And when you have somebody who's leading the country giving information who's not trained in medical facts, and it's not just false information, it can be harmful for patients. So people are very confused. I'm glad we're having a discussion that can help educate patients and the public in general, because we know everybody's just looking for that right answer for what to do for their pregnancy. And of course, we want more people who have autism to get the help and the resources they needed. And falling back on saying Tylenol is the cause when we know that it is not can be really concerning.
Professor Gardner, what do you say to concerned moms out there with children with autism, like Karen here, who may now be feeling shame and guilt of it's my fault, right? Out of concern that they took Tylenol during pregnancy that could have caused their child's autism. That's what they may be thinking now after this announcement. What's your message to them?
In the field of psychiatry, we actually have a pretty dark history of blaming the mothers. So when we first started to even consider the condition of autism and what might be the cause, the very first place that doctors and researchers looked was actually at the mother's behavior. And so I'm really concerned that this harkens back to those darker days where we blame the behavior of the parents for the child's condition. And so my message to them would be, exactly as it was said before, that this is a really complex condition that arises from a complex interplay between genetics and the environment, and that to blame oneself for what might happen, for any health effect in their child, is really something that's not useful. It's certainly beyond any of the science that we have. And so I think that we should definitely try to be reassuring to those parents.
So those parents, including Karen right here, I want to bring you back in to wrap this up. Karen, what is your message to the president and his administration about this announcement? And I know it's not just you're talking to other mothers in this community, other parents who are reacting to this. What is your message?
We need support, and we need valid science and research that helps support the children that are here, the families that are living with it, that doesn't necessarily seek to cure autism, but to find ways to improve communication, to reduce the suffering that autistic children and adults go through, because the world just isn't set up for us. And that goes hand in hand with supporting families, because when families do better, so do their children.
Just really quickly, do you have a reaction to the White House announcing this leucovorin as a potential treatment?
I do in a couple of different ways to look at that. One, like we saw with Ozempic, I don't want the patients who need it most to lose access to it because a bunch of, I don't want to say off-label use because I'm not a physician, but using it for other purposes than what it was originally intended. Also, there's a long history in the autism community as well of very harmful interventions. We can use that word very loosely, I think. I'm just really concerned that parents that are desperate for support and desperate for help and answers are going to see this as an opportunity to, quote unquote, heal their child. And it may work for a certain subset of autistic children. There may be some results and some benefit, but it is not just a blanket cure for autism.
Really important to hear your perspective, Karen, in this conversation, as well as yours, Dr. Crawford and Professor Gardner. Thank you all so much.
Thank you.